None of this has been planned. It's very exciting. It's what we do all day, every day. At some point, we're just like, this is as much as we can make, and that's just all there is to it. I mean, when we're out, we're out. Oh, that was good timing. We've been working together since the day we met. We're always under pressure. Sometimes we listen to podcasts, books, try and surprise people with the flavor combination.
And we've spent 3 lifetimes together already.
Probably, yeah. Because we work together pretty much the whole time.
24 hours a day.
40 came and went. You really need to get a mammogram. So I did.
So when Lauren first came to see us, she had just been diagnosed with breast cancer. But then she had some additional imaging which showed additional areas of concern in the breast. And then we had another conversation with Lauren about options. Lauren wanted to get to treatment right away.
We debated what to do with the diagnosis ad nauseum.
Her reaction was thoughtful. She actually carefully considered all 3 options. We talked a lot about the pros and cons of all of the approaches.
Dr. Loveland Jones, she made me feel very confident. I don't know, I just trusted her right away.
Lauren and her husband asked a lot of really good questions.
Once you've walked into that space, and I think they give you that kind of reception, and they give you the follow-up and the amount of attention to care, it allows you some space to breathe, so you have time to make good decisions.
The final decision was a double mastectomy, and we supported that decision. It makes it so that she didn't have to have mammograms every 6 months, MRIs, and that constant worry of, are they going to find something else?
Right.
Am I going to need another lumpectomy in the future, to your husband's point?
Yeah. And to avoid potential radiation and chemo and additional drugs. That was the initial hope. After the mastectomy, Dr. Grana, what she told me was that it was really aggressive.
We spent a lot of time going through the tests, going through the rationale for chemotherapy and the types of chemotherapies.
Nobody ever pushed us out. I never felt that way.
Yeah, they were more concerned with understanding and comfort than they were with schedules and appointments.
Basically, they were saying, well, it's going to be up to you. It's going to be your decision.
It's her choice.
The decision making is very individual. And I try to sort of help the patient say, okay, so if we make this decision and your cancer happens to come back, how will you feel? If you can live with that, I'm okay with that. And many patients will say, well, I think I've done enough. I'll be okay. If this comes back, I will be okay dealing with that. Other patients will say, I need to do every single thing because if it comes back, I won't forgive myself.
If I didn't consider the chemo and the additional medicines, that it would be treatable but not curable. So I stopped messing around with trying to find the loophole.
But the chemo experience.
I did the chemo.
But the nurses there.
The nurses, I'm getting there.
Oh, okay.
The nurses are great.
Remember when you baked the bread and we had that party here?
Yeah.
Remember?
I forgot about that, actually.
Yeah, I didn't forget.
And I in my memories just came up when I hennaed my head. So
did you remember how beautiful that was?
yeah, I did.
Yeah. We're your support, we're your family.
I looked forward to just being cared for, and really being in a position where there was nothing else I could do. The emotion kind of came after, when kind of came to terms with the fact that the process is ongoing.
We're not just looking to prolong life, but we also need to consider quality of life and a long life with quality, because every year that passes, risk is less and less.
Less medicine.
Less risk and less medicine. Lauren is doing beautifully. She's 3 years out from her initial diagnosis. She's cancer-free, and she's doing beautifully.
MD Anderson at Cooper represents hospitality in a hospital or a healthcare setting.
That's what I love about medicine. That's what I love about the fact that where else, what other career do people let you into their lives?
Right. Well, when you're feeding people, you're at there. That's right. It's very intimate, actually.
I did get cookies. There is a magical ingredient.
I got lots of cookies, and they were amazing. My entire staff loves the cookies.
I just wanted you guys to have them as a treat. Just share. I mean, my thumb does not straighten anymore. Like, it's thousands and thousands of cookies.
We're not treating breast cancer. We're treating Lauren, who has a bakery and who has a family.
It's a process, and I have felt in safe hands with MD Anderson at Cooper. I didn't say that well enough to use the whole thing.
Cut.